Hi. Today I want to talk a little bit about fibromyalgia and how it might relate to surgery. And everyone's situation is going to be really different, and everyone's experience is going to be really different. But I thought that I could at least share mine, and hopefully it'll be helpful for um, people who are getting ready to have really any kind of surgery, actually, who also have fibromyalgia. Um, So fibromyalgia, for people that don't know, is it's a collection of symptoms that tend to occur together. It's not technically a disease because it's not related to a specific identifiable cause, which is one of the criteria for a disease. Um, but it's chronic, long-term, at least 3 months or more, um, widespread pain. Um, it's soft tissue pain. Some people also have like shooting nerve pain. Some people experience joint pain as well, but that's usually from something else, like an arthritic kind of condition. Because fibromyalgia isn't necessarily like an articular disease; it's more like the soft tissues of muscles and nerves. It causes a lot of tenderness, so that can look like hyperalgesia. So things that would normally be painful to people will be like super painful to people with fibromyalgia. It could also be more like allodynia, which is feeling pain from things that aren't typically painful. Like if I'm flaring up, meaning I'm having an increase in symptoms, sometimes my skin will be super sensitive. So just like going like that on it and just touching it lightly will feel like someone's taking a burning piece of metal and just going across my skin. Um, let's see. A lot of people also experience fatigue, um, and that kind of goes a little bit in line with fibrofog. Also, is a common symptom that people experience, which is like cognitively you're kind of out there, and it kind of looks a little bit like dementia. Like you walk into rooms, you don't know why you're there, you don't understand what's going on, you can't put things together in your mind. Um, just a lot of confusion, and you're just in a fog. I mean, that's a really good descriptor of it. Um, a lot of people have really poor sleep. They've found that fibromyalgics tend not to get enough delta wave sleep, which is the really deep restorative level of sleep. And that can also intensify other symptoms like pain. A lot of people have um, migraines, digestive issues, sometimes reproductive health kind of issues like um, endometriosis or just painful periods or things like that. Um, Restless legs syndrome, which is like, especially when you're going down to sleep, you have like tingly legs and you just feel like you need to move them, and they're all like creepy crawlies inside. It's weird explaining it. Um, and then a lot of people also have depression, which may or may not be related to fibromyalgia, but I think that most people living with chronic pain 24 hours a day, 7 days a week, all the time for years, tend to get depressed because it's hard to deal with. Um, for me personally, when I was first diagnosed, my symptoms were much worse. It was hard to do like daily activities of living, like standing and walking and dressing and things like that. But as I adjusted and got a lot of really good treatment, I was diagnosed pretty quickly. Um, things got a lot better, and today I can do things like dance. Like I didn't think I would ever dance again, which is something I like to do. Not that I'm like an awesome dancer or something, but just for fun. And I do drag also. I know, shock. So, um, so yeah, so things have really improved in that front, even though it's something I live with still daily and have pain all the time. So, how does this relate to surgery? People who are Actually, first of all, drug interactions is a really big thing. You can actually see kind of my home pharmacy in the background here. Um, but yeah, so I'm on a good number of prescriptions that are helpful for some of the symptoms of fibromyalgia. Um, and so I had to go through. They always ask like what medications you're on, and I had to like give them a list, and we had to check and see what interactions there are going to be. If there's a risk of liver problems and things of that nature. And in this case, there actually were some issues with my medications. For example, I take something that helps me sleep, and the night before surgery, I can't take that. So that will likely be the longest night ever. Because I normally can't really sleep very well without that anyway. Um, uh, Not because I'm dependent on it, but just because I couldn't sleep before I was on it, and then I started using it, and it helped me sleep. But also with like the anxiety of the night before surgery. Yeah, which is fine. The worry there was that there might be interactions with the anesthesia. Anything that is meant to help relax, I can't take the night before surgery, which is really just the sleep medication there, um, and valerian root sometimes. Um, and so yeah, so checking for drug interactions. People with fibromyalgia tend to not bounce back from things as well. Um, so if I uh, lift something up that's really heavy, like I might in the immediate have like strong muscle cramps, or like sometimes if I hold heavy thing, my hand like gets frozen in that position and it just cramps up everywhere. But the next day, like it'll just feel like a train wreck sometimes. Uh, and if you get injured, you just don't come back very well. It just takes longer to get back to your baseline for people with fibromyalgia. And so, someone having surgery, it might take them a little bit longer to recover. Also, staying too still. If you don't have some gentle exercise and keep moving, it will increase your pain. If you overdo it, it will also increase your pain. You really need like to be in the middle and find what works for you, like that range. And so I'm obviously going to be laid out for a good amount of time, so I'm going to try to be extra careful to like stretch regularly as much as I can and move as much as I can without, messing things up. Um, and I will be on pain relievers, but pain relievers for fibromyalgic pain tend not to work very well, um, just because of the nature of fibromyalgic pain. It's more of a central nervous system thing than like something that's in your joints or muscles or like inflammation. There's not inflammation with fibromyalgia. Um, so anyway, so I'll be checking in about that. If you hear me talking about having a flare up related to that, this is what I'm talking about. And I'll try to remember to include that information in my videos after surgery.